Following on from 3,297 cases yesterday and 2,846 cases on Tuesday, this continued rise, and also the number of hospitalisations we have, which today sit at 205, means that we are now confirming our shift to phase 3 of our planned Omicron response. That will happen as of 11:59 p.m. tonight. We've continued to monitor the outbreak very carefully and to consider the public health advice that we've been receiving before we've come to that decision. With the numbers rising sharply over the last week, as we expected that they would, I don't think the shift is going to come as a surprise to many people. Most people have been preparing and gearing up for this moment. Details of the changes and what they might mean for you are being provided on the Unite Against Covid-19 and the Ministry of Health websites. They'll be available from this afternoon. However, I do want to provide a reassurance that phase 3 won't mean any sudden lurch in terms of personal restrictions or movements. So our priorities now shift to isolating those with Covid-19 and their household contacts to reduce the spread, while at the same time supporting supply chains and essential businesses and services to continue to operate. So we'll do this, in order to do this, there'll be a number of changes that you'll see when we move to phase 3 from midnight tonight. Only confirmed cases and their household contacts will be required to isolate. So I'll run through that again. It will only be confirmed cases and their household contacts, the people who they live with, who will be required to isolate. All other contacts will be asked to monitor for symptoms, but they do not have to isolate. Rapid antigen tests will become the primary means of testing for COVID-19. They'll be available through thousands of sites around the country, including pharmacies and GP practices, and we've got millions more of them arriving in the coming days. Major shipments are due today and over the weekend. We expect businesses to be able to make rapid antigen tests available to the public for purchase through retail outlets from March. We'll have more details of that in the next day or two. We're also now moving to the stance of greater self-management when it comes to COVID-19. That includes the use of new self-investigation tools, which will support positive cases to self-notify their contacts. Because only household contacts are required to isolate, the tool will help us to keep track of exposure events and locations and the overall spread of the virus. Contact tracing teams, though, our teams, will be focused on identifying and tracing those who have visited very high-risk locations, such as a hospital or an aged care facility, and there will continue to be support for those members of our community who aren't digitally set up to engage in that way. Hospitalisations now become a major focus, and daily case numbers will become a less important metric from this point onwards. This is critically important. Practical changes to ease some of the pressure on our health system over the next 3 to 6 weeks have been driving the changes that we've been announcing today. And that ensures that we can keep critical services and supply chains remaining operational and keep our economy moving as well. So there's no doubt the next few weeks are going to be pretty challenging, but New Zealand's better positioned than most countries to respond to Omicron. We will get through this. We've seen and learned from what's happening overseas. We just need to stick to the plan that we've set out as we manage higher number of cases in our coming weeks before we will reach a peak as other countries have. Because so many New Zealanders are now vaccinated, and because Omicron has a less severe reaction or triggers a less severe reaction amongst many people, we can have that more devolved response, placing a much greater emphasis on self-management, allowing our teams to focus more on the vulnerable and on the most vulnerable. Preparation and supporting will be a key for many people. We've been asking people to prepare for the last few weeks, both mentally and also by putting their plans in place. So making an isolation plan, having their stay-at-home kit ready, talking to their friends and whānau about how they will manage through if they and their household needs to isolate. Our high vaccination rate should also help us through the next period. We still strongly encourage people to get their booster doses if they have not already done so. We're currently nudging around 70% of people who are eligible for a booster have either taken one up or who have booked in. So there is still room there for us to get ourselves even more protected in the coming days by people taking up their boosters. You are far less likely to end up in hospital if you get COVID-19 if you've had a booster, and the Director General, I know, can speak more to that. Care and support will be available in the community for those who need it most, as it always has been, and our community providers being resourced to provide care in the community and wraparound health and welfare services alongside clinical care for those who have higher needs. So whatever phase 3 might mean for you as people, as businesses, as organisations, as communities, I want to reinforce that we have carefully planned for this, and that New Zealand is in a much better shape going into the potential peak of Omicron cases than many other countries.
One of the reasons we've advised the move to phase 3, and as the Minister's suggested or hinted at, around 5,000 cases at least, a combination of both PCR confirmed and rapid antigen test confirmed cases today. There is increased demand for testing, and the planned move to this phase 3 and the planned move from PCR testing, which has happened over the last couple of days around the country, especially as demand has grown and case numbers have grown at community testing centres, and rolling out more widely over the coming days to general practices and a range of other places, will help ease the pressure on our laboratories so that our PCR testing will be used for people who are unwell or more susceptible, for example, in those who are in hospital, people who are immunocompromised, pregnant people, others for whom it's very important in terms of clinical management to have a specific diagnosis. To speed up the testing process, both symptomatic people and asymptomatic close contacts whose rapid antigen test is positive will be considered a case without the need for a confirmatory PCR test. And again, just to reiterate the Minister's comment, thank you to the people who have already started uploading their positive rapid antigen test results onto my COVID record, and we will be incorporating those into our daily numbers from here that we do report. People should also advise their employer of their positive result, of course, so that appropriate measures can be taken to identify any potential contacts in the workplace who may need to consider their own movements and so on. Now, rapid antigen tests will continue to be used for critical workers who are household close contacts to help support them to return to work if they need to, if they are critical workers. So recalling that at the moment, both cases and household contacts need to isolate for that 10-day period, but household contacts who are critical workers, who are asymptomatic, will be able to still use that exemption scheme and use rapid antigen tests to be able to go back to work. We'll also be following up any rapid antigen test positives we get from people who start coming across the border and with a PCR test. This is so we can do whole genome sequencing if they are positive, and this helps with our ongoing surveillance at the border. Now, businesses have been able to import rapid antigen tests since the beginning of December, and we know businesses, however, like ourselves, have had challenges in procuring supplies because of global constraints. Those are easing, and as the Minister said, we have large supplies now starting to arrive over coming days. There may not be rapid antigen tests on shelves immediately, but they will be available soon in retail outlets. Likewise, in Tamaki Makaurau, general practices and urgent care clinics will begin to roll out supervised rapid antigen tests from today. The important point here is to find out whether or not your general practice has got the tests and is it doing this. Check on the HealthPoint website. That will have an up-to-date list of all the places you can get a rapid antigen test. We do have enough in the country to help us through a widespread Omicron outbreak in coming months. 1 million more. We had 6.3 million unused tests yesterday. 1 million arrived last night, and there is another 4 million arriving today. And again, further shipments coming over this coming week, with around another 10 million at least arriving over the next week. We are getting them out to places, but as you know from demand on certain supermarket products at times, there can be a mismatch between demand and supply. And in the case of the centre in Birkenhead in Auckland, yes, there was a shortage and more stocks have been supplied there. I should say one of the things we are trying to anticipate is also the impact of people being cases and contacts on supply chains and logistics like courier companies, and so we have got the rapid antigen tests as dispersed as possible through the system. Just on isolation and why we're moving to just household contacts. We know that with Omicron, as with other prior variants of the virus, household contacts are by far the most likely to become infected as secondary cases. And that's why in this phase we are focusing now just on household contacts isolating. So as the Minister said, from tomorrow only cases and their household contacts will be required to isolate. Now, while other contacts will not be required under the Section 70 notice to isolate, clearly it's important that people know if they have been in contact, and that's why we're asking cases to self-register and let their contacts know, because they may need to take appropriate precautions. They may need to let their employer know if they're a critical worker, for example, and likewise they may need to, for example, modify what they do, not visit older relatives or people who may be susceptible if there's a risk they were a contact. And for everybody, for all of us, this is a time to be really mindful about who you visit over these coming weeks. And it's not the time to go and visit older relatives in aged residential care if you might have been a contact. As we did early in the pandemic, act as if you have COVID and look to protect others around you. Remembering that over a third of people who are infected with Omicron, if they're vaccinated, will not have any symptoms. So it's important we all do our bit there. Boosters, the Minister has mentioned, and what I just want to focus on with my brief comments on this today is our modelling of the low transmission scenario, such as the one that Dr. Gary Jackson at Counties Manukau talked about yesterday, assumes high rates of booster uptake. At the moment, nearly 70% of eligible people have done so. We need to increase that, and recently published evidence just in the last week from studies by the CDC in the US show yet another reason why this is important. There has been some question about whether the vaccine, even people who have had 3 doses, protects from either being infected or from transmitting to others. There are 2 new studies from the American Centers for Disease Control and Prevention that now confirm the vaccine protects against getting infected in the first place, and it's hard to pass the virus on if you're not infected in the first place. And just as that we know they protect against severe illness. And this is quite profound. One of the studies, which was published in the Journal of the American Medical Association, shows that compared with being unvaccinated, the odds of contracting Omicron after receiving 3 doses dropped by 67%, 2/3, and for Delta the risk declined by a stunning 93%. So yes, 3 doses of the vaccine doesn't just protect from hospitalisation and death, it protects people from being infected by Omicron in the first place. So a highly boosted population here will serve us all well. Finally, just to let you know that our health sector has been working hard over the last few months to get prepared for Omicron. There's been a lot of work undertaken by district health boards, by our primary care providers, by community providers. All DHBs have plans in place. You will have seen the hospitalisation number at the moment, over 200. Now, that's a significant impact, but our hospitalisation rates across the country are on average 85%. That's about what they usually are. ICU occupancy is about 62%, so we have capacity in the hospital system, but we want to try and keep the hospitalisations down as low as possible. Even now, with over 25,000 active cases, the hospitalisation rate is less than 1%, so it's much lower, but the number of active cases will drive our hospitalisations. If you are unwell for any reason, you should and can safely seek care throughout the health system, and that includes inside our hospitals.
If you are a household contact, you have someone in your household who has COVID-19, you are required to isolate. If you have a friend who has COVID-19, you can make a judgment about whether you think that you would be at risk based on the nature of the contact that you've had, or a workmate based on the nature of the contact that you have had. We are moving to a position now where there will be a much greater number of COVID-19 cases in the community, and we are asking New Zealanders to accept a much greater degree of personal responsibility for what they do around that.
How concerned are you about what's happening down the road? You have a big group of people yelling, singing, no masks, all close together.
Oh, I'd be as concerned as anyone else because we know exactly the sorts of things that are likely to spread this virus, and so it puts people there at risk. And some of those people, especially because we know there are lower vaccination rates, will get unwell, and particularly unwell, and that to me puts them at risk, and so I'm concerned about that. Well, we have seen reports that there have been people who have been at the protest who have sought care at the hospital through the emergency department, most likely because they are away from their usual place of residence, so they've sought care there. Yes, and so there have been people who have been at the protest and have turned up at the hospital, and have, because everybody going through the EDs at the moment is being tested, they have tested positive for COVID-19. What I'm not sure is whether they sought care because of COVID-19 related symptoms or for another reason.
So how many people from the protest have turned up at the hospital and subsequently tested positive?
I don't have an exact number on that.